الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Major manifestations of infection, a practical look by Professor M. Hani Sulaiman. Definition: fever. What is the definition of fever? Equal to increased body temperature above normal circadian variation due to change in thermoregulatory center in anterior hypothalamus. Normal body temperature for individual aged 18 to 40 years is 36.8 plus or minus 0.4 degrees centigrade with a nadir at 6 a.m. and peak at 4 to 6 p.m. By this criteria, an AM temperature above 37.2 degrees centigrade or a PM temperature more than 37.7 degrees centigrade would define fever. This diurnal variation preserved in most forms of febrile disease, but is lost in hyperthermia. This is important. Fever is a characteristic feature of most infections, but found also in a number of non-infectious diseases as autoimmune and inflammatory disease. Normal daily temperature variation is typically about 0.5 degrees centigrade. However, in individuals recovering from febrile illness, this daily variation may reach 1 degree centigrade. During febrile illness, diurnal variation usually maintained, but at a higher febrile levels. During febrile illness, diurnal variation usually maintained, but at a higher febrile levels. Daily temperature variation fixed in early childhood. In contrast, elderly individuals can exhibit decreased ability to develop fever. Elderly individuals shows decreased ability to develop fever with only a modest fever even in severe infections. Rectal temperatures are generally about 0.4 degrees centigrade higher than oral readings. Lower oral readings are probably due to mouth breathing, which is a factor in patients with respiratory infections and rapid breathing. Lower esophageal temperatures closely reflect core temperature. We will talk about, we will mention core temperature in occupational medicine lectures. So core temperature is an important, significant word. Tympanic membrane thermometers. Nowadays, we find this tympanic membrane, which is more easily in use in many hospitals and clinics. These tympanic membrane thermometers measure radiant heat from tympanic membrane and nearby ear canal and display that absolute value, unadjusted mode, or a value automatically calculated from absolute reading. This is important. On basis of nomograms relating radiant temperature measured to actual core temperature. So the adjusted mode reading is good measure for actual core temperature obtained in clinical studies. These measurements more variable than directly determined oral or rectal values. Studies in adults leading to reading are lower with unadjusted mode than with adjusted mode tympanic membrane thermometers, and that unadjusted mode TM values are 0.8 degrees centigrade lower than rectal temperatures. يبقى the advice is to use adjusted mode of TM thermometers. In women who menstruate, AM temperature is lower in 2 weeks before evaluation. It then rises by about 0.6 degrees centigrade with ovulation and remains at that level until menses occur. Body temperature can be increased in postprandial state. Pregnancy and endocrinologic dysfunction also affect body temperature. Pathogenesis of fever. Normal body temperature maintained despite any environmental variation due to the ability of thermoregulatory center to balance heat production with heat dissipation. With fever, balance is shifted to increase in core temperature. So core temperature increase in fever. Pyrogens initiate fever by their effect on hypothalamus heat regulation. They may be endogenous pyrogens, produced by macrophage and monocytes, or exogenous from outside body, like organisms and their products. Production of cytokines IL-2, IL-4, IL-6, and TNF. These are the cytokines. So production of cytokines will lead to increase in production of prostaglandin E2, PGE2, prostaglandin E2. This prostanoid has peripheral and central effects. Peripheral effects, it is responsible for non-specific myalgia and arthralgia that often accompany fever. Centrally, it starts process of raising hypothalamic set point for core temperature. So, prostaglandin has two effects, peripheral and central. Peripheral, non-specific myalgia and arthralgia. Central, raise hypothalamic set point for core temperature. Accompaniments of fever. What fever is accompanied with? Myalgia, chills, rigor, sweats, febrile convulsions, acute phase reactant. Myalgias, arthralgias, and anorexia. Even we refer to it in special epidemiology as constitutional manifestations. These are comes with fever. Myalgia, arthralgia, and anorexia, peripheral effects of prostaglandin, abolished with use of cyclooxygenase inhibitors. We'll talk about this drug. Cyclooxygenase inhibitors. Chills equal sense of cold occurring as part of CNS response to new step point calling for more heat. Rigor is a profound chill with shivering and piloerection of the hair, the muscle of the hair, piloerection. Sweats occur with activation of heat loss mechanism due to effect of antipyretic. or elimination of febrile stimulus. Febrile convulsions occur in those less than 5 years. Acute phase reactant proteins affected in acute tissue damage will lead to increase in complement, ferritin, C-reactive protein, and fibrinogen. So these are what accompany fever: myalgia, chills, rigor, sweats, febrile convulsions, and acute phase reactant. Here another question: what are patterns of fever? We order nurse to take temperature of the patient at least twice daily, one in the morning, one in the afternoon. Why? To find out the pattern of fever. Pattern of fever: relapsing fever, febrile episodes separated by intervals in terms of days of normal body temperature. يبقى febrile episodes separated by normal temperature. This is called relapsing fever. As in Pale-Epstein fever in Hodgkin's lymphoma. Intermittent fever: elevated temperature is present only for some hours of the day and becomes normal for remaining hours. Malaria, pyrexia, or septicemia. So intermittent fever, elevated temperature, only for some hours of the day, the temperature is raised and becomes normal for remaining hours, as in malaria, pyrexia, or septicemia. Remittent fever: temperature remains above normal throughout the day and fluctuates more than 1 degree centigrade in 24 hours. يبقى remittent fever above normal throughout the day and fluctuates more than 1 degree centigrade in 24 hours, as happened in infective endocarditis, viral infections, and tuberculosis. Continuous fever, sustained. Temperature remains above normal throughout the day and does not fluctuate. Here is the difference from remittent. Does not fluctuate more than 1 degree centigrade in 24 hours. Labor pneumonia, typhoid urinary tract infection. Control of fever: physical cooling, cold foments, cooling blankets, ice bath. Control of fever continued. Resetting hypothalamic set point and alleviating constitutional manifestation with antipyretics include aspirin. Mechanism: this we mentioned before, cyclooxygenase inhibitor. So aspirin is a cyclooxygenase inhibitor and so decreases prostaglandin formation peripherally and centrally. Side effects: this is important. Allergy, gastric mucosa, irritation, bleeding tendency, and this is most important, Trice syndrome, which is acute encephalopathy and diffuse microvesicular fatty infiltration of liver, which is fatal in 50% of cases due to cerebral edema if used in children with viral disease. The most famous is in chicken pox. So, Rice syndrome, acute encephalopathy, and diffuse microvascular fatty infiltration of liver, which is fatal in 50% of cases due to cerebral edema if used in children with viral disease. My advice is not to use aspirin in children, whatever the case. Acetaminophen mechanism: it lacks peripheral inhibitory effect on prostaglandin synthesis. mechanism of acetaminophen lacks peripheral inhibitory effect on prostaglandins, so has no anti-inflammatory actions, but it decreases senses of prostaglandins centrally, so its potent antipyretic effect. Side effects: few when compared with aspirin. Remember that in decreased therapeutic doses, this drug may lead to fulminant liver failure. If you increase the dose, it may lead to fulminant liver failure. So use it with caution in patients with liver disease. NSAIDs, non-steroidal anti-inflammatory. These are potent antipyretics and anti-inflammatory. Examples: diclofenac, indomethacin, ibuprofen. What is about hyperpyrexia, which is HAM, important? Definition: extraordinarily high fever. This is the definition: more than 41.1 degrees centigrade fever. Pathophysiology: body temperature center sets body temperature above normal, so the regulation of heat center is changed. It is set body temperature above normal temperature, then generates heat to achieve this temperature. يبقى first change in the center, then in reaction to this increase in the setting of center, the body try to get this temperature. Clinically, patient has high fever more than 41.1 degrees centigrade. Delirium, hallucinations, and muscle rigidity may be present. Hyperpyrexia observed in patients with severe infections, but most commonly occurs in patients with CNS hemorrhages. More commonly occurs in patients with CNS hemorrhages. Treatment: antipyretics, decrease body temperature, cooling blanks, and cool water sponging, recommended to accelerate peripheral heat losses. However, peripheral cooling with cooling blanks can be counterproductive in absence of antipyretics, since cold receptors in skin trigger reactive vasoconstriction, thus reducing heat loss mechanisms. My advice here: not to use this to decrease temperature in case of hyperpyrexia. Hyperthermia, which is very important, and we will mention it in occupational medicine section. Although most patients with increased body temperature have fever, there are circumstances in which elevated temperature represents not fever but hyperthermia, also called heat stroke. Hyperthermia characterized by uncontrolled increase in body temperature which exceeds body's ability to lose heat. The center is not affected in heat stroke, in hyperthermia. Setting of hypothalamic thermoregulatory center is unchanged in contrast to fever in infections. Hyperthermia does not involve pyrogenic molecules. Exogenous heat exposure and endogenous heat production are two mechanisms by which hyperthermia can lead to dangerous high internal temperature. So the mechanisms used are exogenous heat exposure and endogenous heat production. In occupational medicine, most probably it is to you due to exogenous heat exposure, and we call it heat stroke. Excessive heat production can easily lead to hyperthermia, despite physiologic and behavioral control of body temperature. For example, work or exercise in hot environments can produce heat faster than peripheral mechanisms can lose it. Look details in occupational medicine. Causes of hyperthermia syndromes. Heat stroke, as we mentioned, which is either exertional or non-exertional. Drug-induced hyperthermia, and here we mention many of these drugs. Neuroleptic malignant syndromes, neuroleptic malignant syndrome, and here we mentioned the types. Serotonin syndrome due to SSRIs, malignant hyperthermia. This is important for those working inside operation theater and for those having anesthesia for operation. Malignant hyperthermia may be due to inhalation anesthetics and succinylcholine. Endocrinopathy, endocrine causes, thyrotoxicosis, and pheochromocytoma. You can read about these diseases in internal medicine. Central nervous system damage, cerebral hemorrhage, status epilepticus, hypothalamic injury. These are important because some patients with increased temperature may come in coma due to this, so you must examine them carefully. Comparison between hyperpyrexia and hyperthermia. As we said, I will read one column. I will read the hyperthermia column. High fever above 41.1 degrees centigrade. Body temperature increase in an uncontrolled fashion and override the ability to lose heat. The thermoregulatory center during hyperthermia remains unchanged at normothermic levels. Heat stroke syndromes, certain metabolic diseases, hyperthyroidism, and malignant hyperthermia. Physical cooling and not antipyretics treatment underlying cause. يعني in occupational medicine we say remove from hot environment in relaxed position. Bacteremia, septicemia, and septic. Definitions. Bacteremia equals presence of bacteria in blood. Bacteremia, bacteria in blood. Systemic inflammatory response syndrome, stimulation of immune system due to any cause. So, temperature above 38 or below 36, pulse above 90 per minute, respiratory rate above 20 per minute, WBC's count above 1,200 or less than 4,000. So it is between 1,200 and less than 4,000. Species. sepsis. Describe sepsis equal symptoms and signs of systemic inflammatory response syndrome to localized primary site of infection. Organisms, usually bacteria, are main pathogen which lead to sepsis. Common gram-negative bacteria will lead to septic shock in 45% of cases. Escherichia coli, Klebsiella sepsis, Enterobacter species, Proteus, Pseudomonas aeruginosa, and Bacteroides fragilis. Common gram-positive bacteria are Staphylococcus aureus, Streptococcus pneumonia, and Streptococcus pyogenes. Clinical picture: septicemia must be suspected in patient with temperature more than 38 degrees Celsius or less than 36 and chills. Tachycardia more than 90%, tachypnea more than 20, and documented infection, documented by lab. Aim of investigation to localize site and type of infection and complications. Lab: urine analysis, culture of blood, urine and sputum, radiological chest X-ray, ultrasound on abdomen, inflammatory markers, C-reactive protein and procalcitonin. Increased treatment: hemodynamic resuscitation, oxygen therapy, inotropic support. Septic shock in 45 of cases, as we said. Streptococcus species, sepsis with multi-organ system failure, hypotension, unresponsive to adequate fluid replacement. Even with best treatment, mortality range from 15% in patients without to 60% in patients with septic shock. Factors contribute to increase incidence of sepsis: corticosteroids and immunosuppressive, chemotherapy, radiation, elderly, diabetics, cancer patients, increased use of invasive devices, antimicrobial drugs. وفي النهاية thanks والحمد لله الذي بنعمته تتم الصالحات.